Hello everyone, I'm Richard DeAndrea from the Centre for Cancer Biology in Adelaide. Congratulations on your 100-year celebration. I hope you're all having a great night. My apologies I couldn't be there. Before I describe our project, I firstly want to say a huge thank you from me and the team here in Adelaide for your support. It means a lot to us. Laboratory research of this type is very expensive to perform, and this level of funding is very hard to come by. So it's really appreciated, and we're very excited about this project. For this project, we will be investigating using cord blood derived cells to specifically target and kill the disease cells in childhood AML. I'm sure everyone there can understand how devastating a diagnosis of childhood AML is for a family. Fortunately, many children with childhood AML can be cured with intensive chemotherapy, but there are still about 30% of these patients who are diagnosed with one of the more aggressive subtypes and for whom the current treatments are inadequate to prevent a fatal relapse. We are very lucky to have the strong support for our research from a family that's been through this, having lost their 3-year-old son Charlie to childhood AML a few years ago. Kelly Stevens, seen in the photo here with her son Charlie, works extremely hard to raise funds to support childhood AML research through Charlie's Rainbow, and she was absolutely elated to hear about this support from Inner Wheel. She can't wait to announce this on the Charlie's Rainbow social media pages, which connect with childhood AML families all over Australia and internationally. I will just very quickly explain how my team and I are going about using cord blood immune cells to target and kill AML cells in a patient. As I'm sure all of you are aware now, cord blood is a rich and special source of blood and immune cells. In this project, we're using a specific type of immune cells called natural killer cells that can be obtained from cord blood. We know that these cord blood natural killer cells can be cultured in the laboratory and then administered to patients as cancer therapy. In fact, there are clinical trials ongoing in the US in adult cancers, and these are showing some remarkable results. This type of therapy could be ideal in aggressive childhood AMLs because the cord blood natural killer cells can be obtained in a short space of time and rapidly prepared for use in the clinic. Our project to investigate this approach for childhood AML actually came out of discussions with Dr. Andrew Moore in Queensland, a collaborator on this grant and a leading paediatric oncologist in Australia who treats many childhood AMLs. He expressed the view to us that an immune therapy such as this is possibly the only treatment that will provide a long-term cure for the children with aggressive subtypes. He's very supportive of this work, given that he sees so many of his patients relapse with untreatable disease after their intensive chemotherapy or even after a blood stem cell transplant. A key aspect of our proposal, indicated on the right, is to address the challenges for optimising the targeting of the AML cells by the cord blood natural killer cells. This will require the use of therapeutic tools or drugs that can direct the natural killer cells specifically to the AML disease cell. And we have a number of assays in our lab so that we can test several options for this. Dr. Moore is providing childhood AML specimens through the Queensland Tumour Biobank, and we have access to cord blood via an agreement with the Sydney Cord Blood Bank. So we're now in a great position to work up this approach in the childhood AML setting. So enjoy the rest of your evening, and thank you again for all the work you do to support research like this. Our efforts to improve the treatment for childhood AML have been greatly boosted by this funding. We're all excited to get this project underway and hopefully generate promising results that will lead to a clinical trial and ultimately a badly needed new therapy option for children with these aggressive AML subtypes.